Over the course of her adult life, Erin Bell has been diligent about her breast health.
I was due for a mammogram last September, so I went. And I got the report back. Everything was fine. I just have very dense breasts.
Dense breasts put women at a heightened risk of cancer. They can be up to 6 times more likely to develop it in their lifetime. Erin's doctor recommended a breast screening ultrasound between her bi-yearly mammograms. That ultrasound should happen right about now.
So I got a call from my doctor's office, from the reception there, saying that the clinic that schedules the bilateral breast ultrasounds is not taking any more patients.
For the most part, there's only one clinic in BC that does the majority of MSP-covered breast screening ultrasounds in the province.
It's largely financial, and so the fee's really not adequate to justify the time that it takes to do a full both sides screening breast ultrasound, and so most places are saying we won't do it.
Last November, Victoria General Hospital implemented an evening breast screening ultrasound shift using an automated system and no technician.
We only let our most experienced technologists do the screening ultrasound here.
Screening ultrasounds are necessary because dense tissue and tumors look the same in mammograms. It's almost impossible to detect cancer.
You can barely see it here, but there's a lump hiding in this dense tissue. And when we do her ultrasound, here's jumping out at you. It's very conspicuous. That's the cancer. Women are certainly being diagnosed later whose cancers are missed on their screening mammograms. Those cancers, they continue to grow and potentially spread, and they're usually eventually found when they're big enough to be feelable as a lump.
BC was the first province in Canada to provide breast density information with routine mammogram results. As a result, in the 5 years since, the number of patients referred for breast screening ultrasounds has increased significantly. BC's health minister agrees access to the test needs to be expanded.
And out that access, we're happy to look at issues around fee codes to make sure that doctors have the right incentives.
In 2022, the Vancouver clinic did over 3,000 screening ultrasounds. It can't handle anymore. The only option for those who can't get in here is to turn to private clinics. The cost of a screening ultrasound is $700.
$700 is a lot of money. We have health coverage. We're not supposed to have to pay for things.
The test is important, Erin says, as early breast cancer detection is known to save lives. Belle Puri, CBC News, Vancouver.